COVID cases are on the rise among children. One North Texas hospital says the rate of kids testing positive has more than doubled. And it appears the rollout of new vaccines for kids 5 and under isn't really taking off. Fox 4's Blake Hansen live in Dallas with details. Blake.
Yeah, Steve, doctors are pointing to that rise in cases, saying now is the time to consider getting your child vaccinated if you haven't already. Pediatric hospitals in the Metroplex are beginning to see COVID cases rise again.
We're seeing a small but steady increase in the number of cases, the number of hospitalizations, and that's being seen also in other parts of the country.
Cook Children's says its 7-day average positivity rate has gone from 3.5% on May 5th to 8.4% June 5th to 21.6% Wednesday. Children's Health in Dallas has seen a rise too.
Certainly nothing close to what we saw with the Delta wave or with the initial Omicron wave, but we're seeing increased numbers. And to me, that's a warning sign.
Researchers say the rise in cases coincides with the spread of Omicron subvariants, particularly one called BA.5.
So it's something that's gotten everyone's attention as the rise is not slowed or stopped yet. And that's where we are right now, just paying close attention to the rise and making sure our hospital systems in the county are prepared.
Doctors still say the best way to protect yourself is getting vaccinated, but the vaccination rate for the youngest children is off to a slow start. A Kaiser Family Foundation survey in April found just 1 in 5 parents of children under age 5 plan to get their child vaccinated right away. And the White House said Thursday nearly 300,000 children in the age group received shots in the 2 weeks since they became available. That's less than 2% of the eligible population.
I mean, I still think that there's a lot of hesitancy out there, to some extent understandable, but what we're observing now is an increase in the number of cases. And it just goes to show you that the COVID's not going away, that the pandemic is not over.
Dr. Jeffrey Kahn says with vaccines taking time to build immunity, it is important for parents not to wait.
We don't have to look back too far to see some lessons that we learned. You know, in November, the end of November, we first heard about the Omicron variant, and within 6 to 8 weeks, it was predominant. We were seeing more cases of children being hospitalized than at any time during the pandemic. That just shows how quickly things can change.
Cook says as of Wednesday, it had 1 COVID patient in the ICU, 2 in non-ICU beds, and for perspective, that is still far off from when there were around 70 patients back in January.